This presentation will analyse and explain how Te Tiriti o Waitangi and cultural safety form a basis for culturally safe practices within New Zealand health. On February 6, 1840, on the grounds of Waitangi in the Bay of Islands, Te Tiriti o Waitangi was signed, then taken around the country mostly by sea to be signed by as many rangatira, which are chiefs, as possible. The Crown was represented by William Hobson, and the indigenous people, Māori, were represented by rangatira, which are chiefs. When being translated from Māori to English, the meanings differed, as the English version favoured the Crown to be a governor rather than protectors of Māori and their sovereignty. By September 1840, another 500 Māori had signed one of the 9 copies of the treaty, and British sovereignty over the whole country was declared. 4 articles of Te Tiriti o Waitangi related to health. Article 1 involves establishing mechanisms, such as structural, to ensure that Māori are involved and represented in decision-making within the health sector. Article 2 states that Māori are required to exercise tino rangatiratanga, which is sovereignty, which means that they are in control of themselves and their own people's destiny within the health sector. This includes the representation of he whakaputanga. Article 3 closely aligns with the practical application by embracing ethical decision-making to reduce the inequities and wider determinants of health within the Māori community. Article 4 involves normalising wairuatanga and te reo me ono tikanga, which is Māori health and cultural protocols. An example in practical application in health is the use of holistic models such as te whiki and te whare tapawhā, which are the most commonly used. To achieve the obligations of Te Tiriti, equity for health, Māori health, is essential. He whakaputanga. Before the signing of Te Tiriti o Waitangi in 1835, a Declaration of Independence was signed by Northern chiefs to claim sovereignty over Aotearoa, New Zealand. It was due to the concerns about the lack of laws to govern the behaviour of European traders, whalers and settlers that were arriving, and other countries wanting to claim Aotearoa as their own. The declaration was drafted by James Busby. Other chiefs signed the declaration up until 1839. How Te Tiriti o Waitangi and cultural safety form a basis for providing culturally safe health service. The inherent principles of partnership, participation and protection within Te Tiriti o Waitangi were derived from the social policy produced by the Royal Commission in 1988. These are applied to healthcare policies and practices through cultural safety to strengthen the relationship between the health sector and improvement of health equity within the Māori community. Participation emphasises the involvement of Māori within the health sector, from working in the Ministry of Health to the DHB to nurses and doctors, being involved in decision-making about improving inequity within health for Māori and health promotion. The principle of partnership within health is the relationships between whānau, hapu, iwi and Māori communities, all working together to develop health services that improve health outcomes for their own people. Protection under Te Tiriti emphasises the sacredness of one's health, the importance of protecting Māori cultural concepts, values and holistic practices, as well as Māori having equality and equity in health. 4 principles specific to interactions between nurses and Māori consumers were established on the basis of the 3 principles of Te Tiriti. To educate and guide nurses to be culturally safe. 4 principles specific to interactions between nurses and Māori consumers were established on the basis of the 3 principles of Te Tiriti. To educate and guide nurses to be culturally aware and safe, This is one example of how Te Tiriti form a basis for cultural safety within a health profession. Principle 1 recognises Māori's right over self-determination and management over health interests by nurses enabling autonomy and acceptance of their patients' knowledge, language and customs, and recognising that they are tonga, which is sacred, and facilitating Māori independence over thoughts and action, policy and delivery, and content and outcome as essential activities for self-management and self-control. Principle 2 involves partnership between nurses and Māori with the shared goal of improving health outcomes for Māori. To do this, working together in decision-making and planning of services and service delivery will achieve a positive health outcome, ensuring that integrity and well-being for both parties is preserved. The third principle emphasises that nursing workforce recognises that health is tonga and to recognise that Māori health is worthy of protection. By promoting a responsive and supportive environment and acknowledging beliefs and practices held by Māori, this ensures that health services are appropriate and acceptable to individuals and their families. Principle 4 states that the nursing workforce recognises the rights of a Māori citizen, equitable access and participation in health services at all levels, throughout facilitating and pursuing equality and equity in the health access and opportunities for Māori. Kaua whakaruroho is an example of how Te Tiriti is implemented within health professionals' practices. This concept was the result of a nursing education leadership hui that took place in Christchurch in 1989 as a response to issues of retention and recruitment of Māori nurses. In 1990, the Nursing Council amended its standards to incorporate cultural safety into its curriculum and assessments. Initially written by Irehapati Ramsden in 1991 and approved by the Nursing Council in 1992. According to the Nursing Council, the definition for cultural safety is the effective nursing practice of a person or family from another culture and is determined by the person or family. Culture includes but is not restricted to age or generation, gender, sexual orientation, occupation and socio-economic status, ethnic origin and migrant experience, religious or spiritual belief, and disability. This forms the basis for culturally safe health practice. This forms a basis for culturally safe health services because it is the informative concept of how nursing practice can be effective when treating another culture. It emphasises the importance of protecting the uniqueness of the patient's cultural beliefs, values, and holistic practices to achieve a trusting relationship with the patient and family to achieve a better health outcome for the patient and their overall well-being, based on Te Tiriti's three underlying principles of participation, protection, and partnership. Health professionals' responsibility in relation to Te Tiriti o Waitangi and cultural safety. The responsibilities of a nurse in relation to Te Tiriti is to enforce cultural safety and the three principles of Te Tiriti within their everyday practice. The Nursing Council recognises the responsibilities of a nurse under Te Tiriti within their competencies. In the Registered Nurses Competency 1.2 states that registered nurses demonstrate the ability to apply the principles of Te Tiriti or Waitangi to nursing practice. The nurse's responsibility is to be competent in the understanding of Te Tiriti and its relevance to Māori health in New Zealand, and be able to apply this to nursing practice. They will also be able to demonstrate knowledge of differing socio-economic and health status between Māori and non-Māori. Competency 1.5 of the Registered Nurses Competencies also recognises that it's the nurse's responsibility to practice in a manner that makes the health consumer determine as being culturally safe. To do this, they apply Principle 2 of the Nursing Code of Conduct within their own practice and recognises the impact of nursing culture on health consumers' care to protect the health consumer's well-being of the health consumer, to hold personal beliefs, values and goals, and assist them with gaining the appropriate support and representation from those who understand their culture, needs and preferences. The health professional will also reflect on their own practice and values, which impact on nursing care and relations. This improves their cultural practice and will help to develop trusting relationships with their patient and families. To conclude, Te Tiriti o Waitangi was signed on February the 6th, 1840, on the grounds of Waitangi in the Bay of Islands, establishing equal partnership between the Crown and the Indigenous peoples, and declaring their sovereignty over their own people. The 4 articles of the Treaty of Waitangi form the basis for cultural safe practice in health throughout the 3 underlying principles of partnership, participation and protection, which can be applied throughout the health sector, within health policies and acts, cultural safety, which is kawa whakaruruhau, and as a basis for health strategies to lower Māori's health inequities. The origins of cultural safety also form the basis for culturally safe practices in health by being incorporated throughout codes of ethics, conduct, and scopes of practice to guide health professionals how to approach their patient in reference to their culture, beliefs, and values, and emphasizes the importance of identifying and considering their beliefs and values when treating the patient. This helps create a trusting relationship between the patient and health professional, which benefits the patient's overall health and well-being. As a health professional, it is their responsibility to uphold these principles and regulations within their practice to successfully treat a patient of any culture.